So I'm Penny Starbuck and I am a newly qualified nurse. I've been with the community nursing team probably about 6 months, but up until the last couple of weeks that was placement based with university. So as I've qualified in my final management placement, I'd already got a job offer elsewhere and I was set on doing that, and then I came here and everybody was really lovely and felt really supported, really enjoyed the community side of things and just begged to stay. I haven't gone since, so and this is technically my 3rd week out on my own, so very new.
I got my first care job when I was 20 years old. I think it was 2018 or something like that. I got that job and it was community care and it was mostly end-of-life care, but I just remember when I was doing it how much I enjoyed it, and I'd never done any sort of care or healthcare before. I've got a degree in something completely different. I've got an arts degree and I never saw my life going this way, but when I got that job I'd work alongside some district nurses and I just remember like thinking, I really want your job and I really want to do what you do. So I thought, I'm going to go to uni and I'm going to do it. And nothing changed my mind throughout that whole journey about working in a hospital or a clinic. It was always, always community. So I'm really glad that I finally got here, yeah. And that's why I wanted to do it.
I think the whole preceptorship's been really positive. I've made loads of new friendships and felt that I've made really new close friendships as well for people that I've not known from uni. We've all supported each other through some when we've been finding it more difficult or when we've been really happy and something's gone really well. It's been nice to talk to each other about it. It's been a nice group.
My desire to work in the community initially wasn't actually there. My history I have had as a carer in the community and didn't like it. So my first placement, I was adamant it wasn't going to be for me. But by the end of the first week, I knew instantly it was going to be the branch of nursing that I'd take. And it's all to do with like seeing the person in their own home and with their families and the support groups, or the lack of, just helping them in that environment rather than in the like busy, bustling, chaotic environment of a hospital.
Seeing and working with a really strong team. Obviously I've had placements over the 3 years and it really did stand out here. You've got really good teamwork and support, and it did just drew me in.
On my first day, everything was laid out for me, day by day, what I'm going to be doing. And it's just it has felt like a really supportive environment. I know there's been times I've been out on visits and I've needed somebody to come with me, and there's just not one person in the office that's not gone, oh, I'll do it, I'll come with you. Like even people I don't normally work with in areas I don't normally work, everybody just wants to help you, and then it makes you want to help everybody else, and it's just such a lovely, supportive environment, it really is.
Like catheters and certain wound cares and dressings. I've not done very many on my placements when I was a student, so having this training has really prepared me for community, because I feel like I've been able to not walk in as it's like a breeze to what it's challenged me, but I think it's really prepared me for the workload when I'm on my own.
Very supported. It's been a gentle ease into it, because I was more worried it would be dropped into the deep end, but it's not been. I've just started going out on my own. I'm just on my 3rd day, and the visits have been reduced so that we've got that more time while we get used to the documentation and the computer work and things. So yeah, I feel like if I've ever needed to ask anything, I came across something today I'd not done before, so I just paused on it, went back in and asked, and I was helped through it because it was the first time I was doing something. So yeah, and I know that a lot of my colleagues, they all tell you that at the end of a phone if you need them and things, so yeah.
Community nursing is such a variety of skills. It's not a specific type of nursing. We're not just looking at bones, we're not just looking at wounds, we're not just looking at diabetes. We're looking at a really broad spectrum of patients to enable them to continue living at home rather than where years ago they would have been probably hospitalised. We can manage their care at home.
You can spend as much time sitting in a room listening to however many people telling you how something is done, but you're just never going to know what it's really like and never feel really prepared until you're there in that real life situation. So I'd say no for that reason. But I'd say yes because we've had a lot like thrown on us, say thrown at us, but we've had a lot put in place for us. So many different things, like we've had sessions on diabetes, which has been really, really helpful because there's not a day where we don't see a diabetic patient. So just understanding who to go to in the trust and all that kind of thing's been really helpful.
When I first started going out on my own, I had very minimal visits, so it was nice to just be like gently introduced to visits on my own and getting used to actually turning up with no one else beside me and like, gosh, I am actually the only person here. So, but it's been nice to like slowly been eased into it, yeah.
I think until you get there, you don't really know, but it is just that everyone's going to expect you to know everything and you don't. You think, oh, and like I kept saying I've got imposter syndrome because I felt like I should still be in the student uniform, because to me I had a couple of week break and came back and I'm wearing the blues and I was like, oh, but nothing's actually changed other than a certificate that says I've graduated. So it's just getting that confidence in yourself.
I think to touch base with the things we've done and maybe do like a little mini catch up with where we've been, like the journey that we've been on and the training that we've had would be massively beneficial. But I do feel as though we've had a lot invested in us, and it does make me feel like these people want us to stay, they want us here. So, yeah.